They say all exercises are good for the body, healthy and beneficial. But today, I urgently need to warn you about something that very few people know or understand. 3 of them, which you probably do almost every day, thinking you're strengthening yourself, could be putting your joints and bones at serious risk after the age of 60. I have seen many of my patients over the decades who perform them daily with pride, firmly believing they are protecting their heart and building strength, without imagining for a second that they might be dangerously damaging their spine and dramatically increasing the risk of a devastating fall that happens without warning. What is most worrying and frightening about all this is that it's not just one isolated exercise, but 3 extremely common movements that can become dangerous and even fatal if not modified properly or performed at the wrong intensity. I am Dr. Ricardo Salvatierra, a physical medicine specialist focused on senior health and injury prevention, with over 25 years of clinical experience helping older adults keep their bodies strong, mobile and completely pain-free without risky movements. Now that you know about this hidden risk that few doctors openly mention, I want us to analyze each of these 3 dangerous exercises together with full attention. Because it is not about completely stopping all physical activity, creating unnecessary panic, but about deeply understanding when and how certain movements can become extremely dangerous specifically for the aging body of an older adult. And we will start immediately with one that absolutely surprises most of my patients every time I mention it. Many are shocked. Some even refuse to believe it at first. For entire decades, this exercise was proudly presented as the ultimate way to build core strength everywhere. We were told repeatedly that it flattened the stomach, strengthened the back, and kept the body eternally fit and capable. And they weren't completely wrong about some real benefits. But after the age of 60, things changed radically inside the body in ways that no one explains to you. And this is exactly where this apparently beneficial and harmless movement can transform into a silent and treacherous enemy of your spine without you noticing anything. I have seen this countless times in my daily clinical practice over more than 2 decades. Older adults who arrive at my office genuinely worried because despite exercising regularly and disciplinedly, they experience unexplained back pain, growing stiffness, or neck discomfort that doesn't improve with rest. When we carefully review their entire exercise routine movement by movement, a clear pattern emerges repeatedly. This specific exercise every single day without exception. And they don't do this with bad intentions or ignorance. Quite the contrary. They are simply following fitness advice that worked perfectly in their youth, completely unaware that the body does not react the same way after 65 when everything weakens. Bones become brittle, discs compress, joints lose cushioning, and what once strengthened may now silently damage. The key is in the how and when you perform it, not necessarily whether you perform it or not. You don't need to be afraid and completely stop exercising forever, creating unnecessary restrictions. But you absolutely need to respect certain modifications and certain dangerous intensity levels that no one teaches you. But before we reveal which these 3 dangerous exercises are and how to properly protect your body, if you are finding this video important and useful so far, leave a powerful like right now for the algorithm to show it to more people who urgently need this information that can prevent injuries. Subscribe to the channel now to receive weekly honest medical alerts about physical health after 60 that your doctors don't have time to explain. And activate the notification bell to never miss videos like this that can literally prevent a fall or fracture. Comment down below urgently. How old are you and which of these exercises do you do every day without knowing the danger? I want to know your story and help you personally with specific guidance. Now, let's dive into the first exercise on this dangerous list that will completely shock you. It's common. It's considered essential for fitness, and you've probably done it countless times thinking it was building strength. The first exercise on our list that can become dangerous for your body after 60 is traditional sit-ups. And I know this will shock many people watching right now. For entire decades, sit-ups were presented as the ultimate way to build core strength, the exercise we should all do daily without question. We were told repeatedly since childhood that they flattened the stomach, strengthened abdominal muscles, and kept the midsection tight and powerful. And they weren't completely wrong about these real and proven benefits when performed by young healthy bodies. Sit-ups do engage the abdominal muscles, create tension in the core, and can improve posture when done correctly at the right age. But after the age of 60, things change radically inside the body in ways that absolutely no one explains to you in quick gym sessions. And this is exactly where this apparently beneficial and harmless movement can transform into a silent and treacherous enemy of your spine, without you noticing absolutely anything until it's too late. I have seen this happen countless times in my daily clinical practice, over more than 2 decades attending to seniors. Older adults who arrive at my office genuinely worried and confused, because despite exercising extremely regularly and disciplinedly following all recommendations, they experience unexplained lower back pain that radiates down, growing neck stiffness that won't release, or persistent spinal discomfort that doesn't improve even with strong pain medication. When we meticulously review their entire exercise routine, movement by movement, rep by rep, a clear and undeniable pattern emerges repeatedly. Traditional sit-ups performed every day without exception, sometimes even 50 or more repetitions daily. And they don't do this with bad intentions or deliberate ignorance. Quite the contrary, they are simply following fitness and health advice that worked perfectly in their youth when they were 30 or 40, completely unaware that the human body does not react in the same magical way after 65, when absolutely everything progressively weakens and compresses. Let me explain exactly why this happens at the structural biomechanical level. Traditional sit-ups place enormous compression force directly on the lumbar spine, the lower back area that is already vulnerable with age. When you are young and vibrant, the spinal discs are thick, hydrated, and act as perfect shock absorbers, cushioning every movement efficiently. But with the relentless passage of time, these discs progressively lose water content, becoming thinner and more fragile like dried sponges. The vertebrae move closer together, pinching delicate nerves. And many older adults already have some degree of osteoporosis, making bones more brittle and prone to compression fractures that happen with minimal force. This specific combination of repeated forward flexion, from sit-ups plus compressed discs plus weakened bones, can create a silent and dangerous situation inside the spine that accumulates. Imagine bending a thin plastic ruler back and forth repeatedly. At first, it seems fine and flexible. Everything appears to work normally. But with continued repetition, microscopic cracks begin to form in the material. Eventually, with one more bend, it snaps completely in half. This is exactly what happens silently inside the aging spine, without you feeling severe pain initially. Each sit-up adds stress to already compressed discs and weakened vertebrae. The neck is pulled forward with hands behind the head, straining delicate cervical structures. When this happens progressively over weeks, microdamage accumulates dangerously. Small tears develop in disc material. Facet joints become inflamed and irritated. And one wrong movement is enough to cause a herniated disc, or even a compression fracture that changes everything instantly. I vividly remember a specific patient, Mr. Antonio Ruiz, a determined and disciplined 68-year-old retired accountant. He came to my office after a strange and frightening episode he couldn't explain. One normal morning, while performing his usual 50 sit-ups on the bedroom floor, he felt a sudden sharp pain in his lower back like an electric shock. He initially thought it was just a muscle cramp, or temporary strain from the previous day. Hours later, when the pain intensified and radiated down his left leg, his worried daughter rushed him to the hospital emergency room. Detailed imaging showed a herniated lumbar disc that had ruptured outward, pressing directly on the sciatic nerve root. When we deeply analyzed his entire exercise routine in the preceding months, we found a seemingly healthy and admirable habit. Every single morning, without exception, he performed 50 traditional sit-ups with his hands locked behind his head, pulling his neck forward forcefully with each repetition. Additionally, he was doing these movements on a hard floor without any cushioning, creating maximum impact on his already compressed spine. His posture during the movement was poor, with excessive rounding of the lower back at the top of each sit-up. Antonio looked at me with profound frustration, that I still remember clearly, and said something that marked me. "Doctor, I was just trying to stay fit and strong. How could exercise harm me like this?" I have heard this devastating sentence more times than I would like throughout my career. Because this is exactly the central problem here. It is not the concept of core strengthening that is the villain, but the specific method, the movement pattern, the intensity level, and the complete disregard for how the body has changed. After 60, the spine is fundamentally different. Discs are thinner and more vulnerable. Bones are weaker and more fragile. Flexibility is reduced, limiting safe range of motion. And what once built strength may now silently create injury and chronic pain. The key is in how, when, and with what modifications you strengthen your core, not whether you should or should not work these muscles. You absolutely do not need to completely abandon core training, creating unnecessary fear, but you must replace dangerous movements with safer alternatives. If you want to strengthen your abdominal muscles and core stability, there are far better and infinitely safer options after 60. Instead of traditional sit-ups, perform modified planks on your knees, holding for just 10 to 15 seconds. This builds deep core strength without any spinal flexion or compression. Practice gentle pelvic tilts while lying on your back with knees bent, engaging the lower abdominals without pulling on your neck. Perform standing core exercises like marching in place with controlled knee lifts, which strengthen abs while maintaining neutral spine alignment. And if you genuinely miss floor exercises, try dead bug movements lying on your back, slowly lowering opposite arm and leg while keeping your lower back pressed flat against the floor. In my extensive clinical experience, these simple modifications can make an absolutely dramatic difference between continued mobility and debilitating injury. A gentle and controlled approach, focusing on stability rather than repetitions, is more than enough to maintain core strength without overloading the aging spine. What is genuinely dangerous and must be avoided is the old-school mentality of more is better, especially explosive sit-ups performed quickly with momentum rather than control. I have seen many patients who made just this simple change, replacing traditional sit-ups with modified core work, and they eliminated chronic back pain, improved posture, and felt physically stronger and more stable within weeks. Core training remains essential as we age. But after 65, it must be approached with respect and knowledge, not with outdated methods from fitness magazines. Now, let's move to the second exercise that also surprises with its popularity, and many perform it thinking it strengthens legs when in reality, it can dangerously damage the knees. The second exercise on our list that can become dangerous for the body after 60 is deep squats with full range of motion. And you probably see people doing them at the gym or in exercise videos regularly. Squat low. Go deep. Feel the burn. How many times have we heard these phrases shouted by enthusiastic trainers? And for younger people with healthy joints, deep squats can indeed build tremendous leg strength and muscle mass. They engage the quadriceps, hamstrings, glutes, and core in one powerful compound movement. For entire decades, they were the gold standard for lower body strength training, appearing in every fitness program and routine. But there is a disturbing reality that very few older adults know or understand. After 60, deep squats can become a silent and serious risk to the knees, hips, and lower back. Not because of the movement concept itself, which has merit, but because of how deeply compromised joints have become with decades of wear and tear. Let me explain something I have seen repeatedly in my clinical practice over decades. Older adults, determined to stay strong and independent, push themselves to squat as deeply as possible, trying to touch their buttocks to their heels with each repetition. They see younger people doing this and believe they should match that intensity to get results. Everything seems like dedicated effort, an admirable commitment until one day, without any prior warning, they experience severe knee pain, hear a disturbing pop in the joint, or can barely walk the next morning. And when we meticulously review their case trying to understand what happened, deep squats performed multiple times weekly are there, present in every workout session. The real problem is not the concept of leg strengthening, but the excessive depth and load placed on joints that have already lost most of their protective cartilage. This cartilage is absolutely essential for smooth pain-free movement. When you are young and healthy, thick cartilage cushions every movement, allowing joints to glide effortlessly. But as we inexorably age, cartilage progressively wears away like old tire tread, becoming thin, rough, and unable to protect bone surfaces. When you perform deep squats, dropping your hips far below knee level, the forces on the knee joint multiply exponentially. At the bottom of a deep squat, your knees are bearing 7 to 8 times your body weight in compression force. For aging joints with minimal cartilage remaining, this creates bone-on-bone contact that damages joint surfaces, inflames surrounding tissue, and accelerates arthritis progression. And if you have even mild osteoarthritis, which most people over 60 do, each deep squat is grinding away what little cartilage protection remains. It is an extremely delicate and dangerous situation that accumulates damage with every repetition. The most dangerous and frightening part of all this is that joint damage is cumulative and often irreversible. You can feel fine during the exercise, experience mild soreness afterward that you dismiss as normal muscle fatigue, and not realize the permanent damage occurring deep inside the joint until it's far too late to reverse. I will never forget Mrs. Patricia Morales, a vibrant and active 71-year-old former dancer. She prided herself on staying fit and flexible, attending group exercise classes 3 times weekly without fail. She loved the challenge of squatting deeply, believing it kept her legs strong and youthful. But every class, she pushed herself to match the younger participants, dropping into full-depth squats with her hips nearly touching the ground. She honestly thought deeper meant better results, until one day she couldn't ignore the pain anymore. Her right knee had become so swollen and painful that she could barely climb stairs or get out of a chair. Urgent imaging showed severe cartilage loss, bone spurs, and significant inflammation throughout the joint. The direct cause was years of repetitive deep squatting that had ground away her remaining cartilage, leaving exposed bone rubbing against bone with every movement. The damage was so extensive that she eventually required knee replacement surgery to restore basic function and relieve unbearable pain. When I visited her during recovery, she said something I will never forget. "Doctor, I thought I was doing everything right to stay strong. I never imagined that exercising too hard could destroy my knee. This is the fundamental challenge of aging actively and safely. Exercise is absolutely essential for health, but the intensity and range of motion must be adjusted to match current joint condition, not past capabilities. Deep squats remain valuable for young healthy joints, but after 60, they must be modified significantly. The most important guideline is to limit squat depth to where your thighs are parallel to the ground, or even slightly above. This reduces knee compression forces by more than half, while still effectively strengthening leg muscles. Never allow your knees to travel far forward past your toes, which multiplies stress on the kneecap and patella tendon. Keep your weight distributed through your heels, engaging the powerful glutes and hamstrings rather than overloading the vulnerable knees. And always perform squats with controlled tempo, taking 3 seconds to lower and 3 seconds to rise, eliminating any bouncing or momentum at the bottom position. Another essential recommendation is to reduce or eliminate added weight if you have any knee pain or diagnosed arthritis. Bodyweight squats to limited depth are perfectly adequate for maintaining leg strength and functional mobility. If you need more challenge, increase repetitions rather than adding weight that multiplies joint stress. And if squats cause any sharp pain, clicking, or swelling, stop immediately and consult a medical professional before continuing. I have seen many patients who learn to modify their squat depth and technique properly, maintaining leg strength without accelerating joint damage. When you deeply understand the biomechanics and respect your body's current limitations, exercise becomes therapeutic rather than destructive. Now, let's move to the third and final exercise that will surprise you most with its hidden dangers. The third exercise on our list that can become extremely dangerous after 60 is high-impact aerobic exercises like running or jumping. And this will absolutely shock many active seniors. For years, cardiovascular exercise was considered essential and universally beneficial. Get your heart rate up. Break a sweat. Push yourself. These mantras have been repeated endlessly in fitness culture. And cardiovascular health is indeed critical for longevity and disease prevention. But what many do not know is that after 60, high-impact activities can become devastating to joints, bones, and even increase fall risk dramatically. I have seen this pattern repeatedly over decades. Patients who have jogged for years, proudly maintaining their running routine well into their 70s. But gradually they start noticing something disturbing. Persistent hip pain that won't resolve. Stress fractures in feet or shins. Balance problems that seem to appear from nowhere. And when we investigate what's happening, the cause is often that admirable, but misguided commitment to high-impact exercise that their body can no longer safely handle. Let me tell you exactly what happens inside the aging body during high-impact activities. Every time your foot strikes the ground, during running or jumping, the impact force travels up through your entire skeletal system. In young people, healthy bones, thick cartilage, and strong muscles absorb these forces efficiently. But after 60, bone density has declined significantly due to natural aging and often osteoporosis. Cartilage has worn thin. Muscles have lost mass and shock-absorbing capacity. And balance systems have deteriorated, making landing unstable and unpredictable. When these factors combine, each impact becomes a potential injury event. Hip joints with minimal cartilage experience grinding damage. Vertebrae with reduced density risk compression fractures. And unstable landings can result in devastating falls that cause hip fractures or head injuries. One of the cases that profoundly affected me was Mr. Eduardo Silva, a dedicated 76-year-old former marathon runner who refused to give up his daily jogs. Eduardo had been running for over 40 years and considered it essential to his identity and health. But his body was sending clear warning signals that he ignored. Chronic knee pain. Frequent ankle sprains. Episodes of dizziness after runs. He attributed everything to normal aging and pushed through the discomfort, until one morning everything changed. During his usual neighborhood jog, Eduardo's ankle rolled unexpectedly on uneven pavement. He fell hard, fracturing his hip and hitting his head on the concrete. The injuries required surgery and months of painful rehabilitation. His running days ended permanently that morning. During recovery, he told me with deep regret, "I thought staying active meant doing what I always did. I didn't understand that my body needed different activities now." His story represents a critical truth about aging and exercise. Activity remains essential, but the type must evolve to match current physical capabilities and limitations. High-impact exercise places excessive stress on compromised systems, while low-impact alternatives provide equal cardiovascular benefits without the injury risk. So what should active seniors do instead? Replace running with brisk walking, which provides excellent cardiovascular conditioning with minimal joint impact. Substitute jumping exercises with marching in place, or step touches that keep one foot on the ground. Try swimming or water aerobics, which offer complete cardiovascular workouts with zero impact forces. Use stationary bikes, or elliptical machines that maintain continuous motion without landing impact. And incorporate strength training with light weights, which builds bone density and muscle mass more effectively than impact activities. These modifications allow you to maintain fitness, independence, and vitality without risking catastrophic injury. The goal after 60 is sustainable activity that you can continue for decades, not intense exercise that ends with injury. I have seen countless patients thrive with modified routines, maintaining excellent health well into their 80s and 90s. When exercise matches current capabilities rather than past performance, the body responds with gratitude rather than breakdown. So yes, cardiovascular exercise remains absolutely essential for brain health, heart function, and longevity. But after 60, impact level makes all the difference between continued mobility and life-changing injury. Now you understand why these 3 exercises, traditional sit-ups, deep squats, and high-impact activities, require serious modification or replacement after 60. This knowledge empowers you to exercise safely and effectively for decades to come. If you found this information valuable, leave a like, subscribe, and share this video with someone you care about. Your support helps us continue providing life-saving information to seniors everywhere. Thank you for watching, and may your body remain strong, mobile, and injury-free for many years ahead.